Well, hello again. I am making another video. In this video, I've been told by family members that I didn't really go over the managing pain as much as I should have. Because really that's a big part of this compilation, if you want to call it that or whatever. And I guess it's hard to put into words. I touched on it a little bit as far as trying to let your natural pain receptors kick in, but I don't think I went into detail. So I think part of it is I've just been in physical pain for so long, I kind of lost track of some of the baby steps I took to make a difference. But thinking back about it, I think it's pretty important to taper off any medications or anything you're doing now, unless it's truly homeopathic. Then you can do it in correlation with, and I suppose you could still do it in correlation with the pain pills. But I want to stress to everybody that that's a crutch and really should only be used when the pain is really acute. And by acute, I mean you can't even talk. So I think that's one of the big differentiators between most people and pain. I'll give you a quick story. I thought I was in a lot of pain for a long time, and during one of my back surgeries, I ended up getting a bone infection. And what you have in some of those blood or bone infections is your whole body goes into spasms. And it's so much pain. Not only can't you talk, you're screaming, but you want somebody to hit you with a bat just to knock you out. And that put everything in perspective because it lasted hours. So now I think about that often and say, oh, what I have now is no big deal. But truthfully, I have pain almost in every part or every joint of my body, and then many muscles that are spasming all the time. And when I talk to other people, their spasms are really what they're overreacting to, in my opinion. And different people have different pain tolerances. I totally get that because my mother-in-law, we kid around and say she's like a silverback gorilla. I think she has whatever that abnormal pain receptor thing is where people don't feel as much pain. I wish I had that, but she is totally that way. Obviously, there's no way for you to compare to somebody else because the way they interpret pain is different. If they've ever experienced pain and now they do, that's different because it's a shock to the system. But anyway, when it comes to pain, try to really analyze it and try to be honest with yourself on how much you can tolerate. And when I say natural pain receptors, I mean tolerate more for a longer period of time and a higher pain level more often will raise your tolerance, and it will make you realize that you can tolerate more. And you say, well, why would I do that? It's torturing myself. It is initially, but you quickly learn that it helps you later on with many daily activities or walking or whatever things that you do. So embracing the pain, I guess, is the phrase of the day. You should really embrace that pain and stop trying to hide from it and stop trying to run away from it. Because number one, the narcotics are terrible for your body and terrible for being addicted, and it really doesn't, it lowers your natural pain receptors and your natural pain tolerance. So in the long run, you're hurting yourself. Again, right after surgery, great time for pain meds. But over time, you really have to do your due diligence even before the doctor says it's okay. Because, some doctors are in it because the pharmacies push the drugs and all this stuff. Certainly talk to your physician. I am no physician. I've just experienced it for, 40 years. But natural pain tolerance is huge, and it allows you to do more because you're able to tolerate more. And by doing more, you can strengthen your body a little bit so that you have less pain. So I hope that makes sense. I hope I helped a little bit. I will probably touch on it here and there, but really try hard to build up your natural pain tolerance and do more. Walk, even if it's just more than you're doing now. So if you're very idle, get up, walk to the front room, walk to the back, and walk around your house until you can slowly build yourself up. I think walking's probably the best overall. For me, that's all I can tolerate. I can't lift, I can't do all those things because my joints are so bad. But and it's not a pain thing, it's just they're failing. So anyway, build that up, and I can guarantee you over the next year or two, you will be very happy you did. I'm as confident about what I'm saying as I'm confident that we're all going to die one day. I am very confident. It is the truth. It's a factual thing. And many pain doctors that I've gone to pat me on the back and say, "You've done wonderful things. I wish all people could do what you did." And so please listen when I say that that's really the key. And just pushing yourself safely, pushing yourself, and you will look back in a couple years and say, "Wow, I'm so glad I did it." I hope this helps at least one person, and also my family, to number one, know what I'm going through, and number two, if you ever experience anything that, whether you're young or old, hopefully that helps. Thanks for listening. Have a good day.